Today we're going to explore. Today we are recording the webinar, and we are exploring our recent State of Working Maine report, and talking about how economic opportunity in Maine is shaped by state and federal policy choices, not just by rural geography, and how ultimately policy solutions that address the regional disparities in Maine will also benefit Mainers all across the state who have low income and who are facing really serious economic challenges right now. We are joined today by the author of the report, James Myall, my colleague. And we are also joined by two people who contributed their stories to the report, Becky and Jesse. Thank you very much for taking the time to join us today, as well as by you. So we hope that you will stay engaged with questions and feedback throughout the event today. You can just put them in chat and you do not have to save your questions for the end. So as you think of them, go ahead and post your questions and we'll kind of gather them all and talk about them at the end. And if you haven't had a chance yet, feel free to tell us where you're joining from in the chat right now. So for those who aren't familiar with the Maine Center for Economic Policy, MECEP's goal is to make sure everyone in Maine has a fair chance at a good life. So we study the economy, we conduct research, we share ideas, we work with a lot of partners to advance economic justice and tax fairness in Maine. And I'm going to just kick it over back to James for one moment, and then we'll go ahead and get started.
Yeah, thanks, Kara. I just want to say also, we at the Maine Center for Economic Policy want to acknowledge that the land sharing and extending beyond Maine's borders is occupied Wabanaki homeland. We recognize the inherent sovereignty of the Maliseet, Micmac, Passamaquoddy, and Penobscot nations, and we work to build durable relations with Wabanaki communities that respect tribal authority, culture, and traditions, and advance the cause of economic justice.
Thank you, James. So with that, we'll go ahead and get started and talk a little bit more about this idea of state and federal policy choices shaping Maine's economy, rather than just geography. So Maine's rural character is central to who we are as a state, but it's also often very misunderstood in economic debates. And as somebody who grew up in a very rural area in Maine, I feel that I can speak to that pretty directly. So, too often, policymakers talk about rural Maine as if it's this totally separate thing from the rest of the state with entirely different problems and solutions. And State of Working Maine 2025 really challenges that idea. And we're trying to show that while there are real regional differences here in Maine, Mainers across the state share many of the same economic challenges. Stagnant wages, limited job opportunities, barriers to healthcare, housing, food security. So the report is making the case that the most effective solutions aren't narrow tax breaks, one-off development deals, but investing in people. Fair wages, a strong safety net, modern unemployment insurance, affordable healthcare. So today we're going to dig into what the numbers tell us and what it will take to build an economy that truly works for every Mainer, rural and urban alike. So one of the key findings of State of Working Maine is that the state and federal responses to major recessions have shaped both the depth and the duration of regional disparities. So I'll kick it back to James to talk about that more.
Yeah, thanks, Kara. Yeah, we find in one of the things we find in State of Working Maine is kind of a growing gap between what we talk about as the greater Portland part of the state and other areas of the state. But what we want to emphasize is kind of that there's not just this isn't some economic inevitability, but it's also a consequence of choices that are made both at the federal level and at the state level. And we really try and look at a distinction between kind of the responses that were made to the Great Recession and then to like the COVID recovery in the wake of the recession that happened there. And I think we're supposed to have charts appear on a slide. Here we go. Um, so we're going to share some charts from the report as we go along. Folks who want to dive in more can look at the full report, but I want to use the charts to kind of highlight some of the findings. So I think we'll get this on full screen in a second. Here we go. So this chart shows kind of the amount of or this we have totals that in the report that kind of show how much of the COVID recovery money through various programs went to different regions of the state, and that shows kind of the funds being reasonably equitably distributed, and so more rural parts of the state getting money in proportion to their share of the economy, although the northeastern part of Maine received the most money. And one of the results of that is kind of what we can see on this chart, which shows the change in real GDP per capita through different time periods. And so the dark blue bars show kind of the basically the change in the size of the economy each year in the wake of the long recovery from the Great Recession from 2006 to 2019. You can see growth was reasonably strong in kind of the Portland, Central, and Mid-Coast regions, but growth was really weak in the other parts of the state. And so in the northeastern part of the state, growth was basically flat over that period, whereas the economy actually shrank in the western part of the state. Whereas by contrast, even you can see that every part of the state grew more on average in the period post-COVID recovery. Um, and even though, but I think another finding is also that the Portland metro area grew the most. So the gap in some sense is widened, but we did at least see kind of more robust growth in these more rural areas of the state during that period. And then on the next slide, you can see some of kind of the result of that. This shows kind of the poverty rate, the share of people living below the federal poverty level in different parts of the state over time. And one takeaway is that you can see that the poverty rate has declined across Maine sort of gradually. But again, the biggest declines have been made in kind of the core Portland area. So that's the cities of Portland, South Portland, and Westbrook. And there's still a disparity between what we see in the more rural parts of the state and in Portland itself. So in many of these charts, we see kind of improvements across the state from different policies that are being enacted. But we also see kind of a disparity persisting between these different regions of the state.
Thank you, James. So we want to move on to the next section. Stronger policies mean stronger participation in rural labor markets. So rural Maine has higher unemployment and lower labor force participation for reasons that are both well understood and are solvable. So many rural Mainers face barriers such as limited childcare, health challenges, and seasonal or part-time work. So policies that expand our care infrastructure, improve job quality, and support workers through transitions can unlock this potential. I think James has a couple more charts to review with us.
Yeah, and one of the stories of the as we wait for the charts to load, I'll give some background. One of the stories of the recovery from the Great Recession and the COVID recession is also the way in which the labor market gradually became stronger after the Great Recession, took a long time to recover, but we started to see in 2018, 2019, much stronger labor markets in Maine, where workers had many more opportunities. And then one of the strengths, I think, of the post-COVID recovery was that we were able to maintain that. So this chart shows the kind of average unemployment rate in different parts of the state. You can see the Portland area is the light pink line, kind of at the bottom, and the highest unemployment rates are in the most rural parts of the state, the northeastern and western parts of the state. And those are persistently higher. But one thing you can see, I think, is that as we recovered from the worst of the Great Recession in around 2011, those unemployment rates did start to gradually go down. And in the very most recent pre-COVID period, those rates, even for the most rural parts of the state, were some of the lowest that they'd been for a long time. And we are seeing those rates sort of starting to creep up again as the economy is weakening, going from 2024 into 2025. But you can also see from this that the peak of unemployment during the COVID period was both much less, and there was a much smaller disparity between what was happening in the rural areas and the more urban areas of the state. So again, some of the supports we saw during the COVID pandemic helped keep people across Maine in their jobs or waiting to go back to work, but attached to work much more than we saw in the Great Recession. And then another finding we kind of looked at not just whether people were working, but the kinds of work that they have. So we do find that folks in the more rural parts of the state, when you get further away from Portland, are more likely to be, as well as more likely to be unemployed. We have some data in the report that talks about how likely they are to be in the labor force in general. So more people are disconnected from the labor force in those rural parts of the state. But there are also more people when they are working, they're more likely to be working less than full-time year-round jobs. And those have implications for policymakers when they're thinking about the kind of work people are doing or the kind of policies that they're putting into place. They shouldn't be assuming that everyone is working. Maine in general has a higher rate of people who are piecing work together through multiple kind of part-time or seasonal jobs, but that's especially true for folks who are working in these more rural parts of the state. And so when we have labor protections, for example, that exempt seasonal workers or only apply to people who are working a certain number of hours a week, that's more likely to be excluding people in these more rural parts of the state.
Thank you, James. And I think that's a good transition into wages and pay, because pay is lower in Maine's most rural regions, especially for women. And workers outside Greater Portland and Central Maine are far less likely to earn a living wage. So stronger wage standards and pay equity enforcement would both boost family incomes and local economies.
That's right. And we looked at kind of how much people were earning relative to kind of a living wage. And, one of the things that I think sometimes you hear folks talk about is kind of like wages you hear this talked about with relation with Maine and the rest of the country, but also within Maine, which is kind of where wages are lower. Perhaps that's a reflection of the fact that the costs are also lower as well. And while that used to be true to a certain extent with housing, one of the things we looked at that we don't have the chart for here is kind of the share of full-time workers in every part of the state who are earning less than a living wage. So that's kind of defining a livable wage as kind of a basic standard of living that helps folks make ends meet. And what we found is that roughly across the state, more or less 1 in 3 full-time workers is still not earning a living wage. But those numbers are actually highest in those most rural parts of the state. So the lower costs there are not compensating for the fact that folks have lower wages, even if they're working full time. But we also wanted to look at gaps, kind of equity gaps in kind of what folks are earning. And one of the things we found is that we looked at the gender wage gap on the previous slide, and we found that the gender wage gap, the gap between what men and women earn, is actually larger in these most rural parts of the state as well. And that may be partly due to lack of childcare options in those parts of the state. It may be partly due to the kind of work people are doing. And it's also probably a reflection of the fact that because the labor market is especially tight in the Portland area, wages are rising even for folks who are traditionally underpaid. And then on the next slide, we kind of looked at racial earning gaps across the state, what it looks like typical monthly earnings for folks based on their race. And we found that those racial gaps are fairly consistent across the state. They're actually larger in the Portland metro region, which may be a reflection of the fact that some of the population of color there are more likely to be immigrants, which is kind of an additional hit on, often results in an additional hit to wages. But one of the big takeaways from this is kind of people of color are earning less than white non-Hispanic people across the state of Maine.
Thank you, James. So I actually want to transition into talking to one of our storytellers. So I'd like to introduce Becky. Becky is the co-founder of a very cool company called Flatwear, which is clothing designed for women who choose flat closure after mastectomy. So her company is based in Midcoast, Maine, where she also works as a realtor. And Becky actually launched the brand's first line of clothing this year, just as the Trump administration's tariff plans began. So Becky, could you talk a little bit about your journey as a small business owner, in terms of what are the key challenges you've faced, how you've responded to those challenges, and also, what your message would be to lawmakers on how they can support others in building and sustaining a business in today's economy?
Yeah, Kara, thanks. Hi, everyone. I'm Becky Johnson. And so I started Flatwear Clothing based on my own breast cancer experience. Um, After my surgery, I learned that there were no clothes that fit flat women. And what turned into sort of my own personal need, um, became a bigger mission to, design clothes for women who are flat and really make that as a valid choice and make sure they feel seen and respected and confident in that choice. So flatware we're very small. It's two of us. When we were searching for production, we really looked, I mean, ideally, we wanted to produce our clothing in the United States because our MOQ, our minimum order quantities, are small as a startup. That proposed a challenge. It also, we couldn't afford to, is the bottom line. Um, Producing in the United States was just too expensive for us. So then we started looking overseas. We chose India. We found a really great company. Um, that has its own challenges, trying to produce something far, far away that you have no control over, you can't see, proved to be really hard. But it was affordable for us as a first time, startup business. So we had a lot of delays with our production. It was supposed to come in April of 2025. It ended up, we didn't receive it until October, just as, even though it was in production, we had paid. We had our production order all scheduled and the number was set. Our order arrived just as the 50% tariff went into effect. So I mean, it turned out, I was looking at it, it was 43% of our entire inventory cost. And as a small startup, that was really a line item that we had not planned for. We couldn't absorb it, and we can't pass that along to our customers. I mean, we're brand new, we hadn't even sold anything yet. So, and these women are cancer patients. We cannot say, oh, now this is what we had thought, we're charging this much more. So that single policy decision really dramatically changed our steps forward. So, as a result of that, we are doing local manufacturing in Maine, even though it costs just about double, per garment to produce. Um, you know, we we're doing that because there's no predictability. We can determine, even though it's more expensive, we know what we are going to pay by producing in Maine. We have found a Maine-based grader. We have a seamstress that we can control the quality, we can control the numbers, and we're not vulnerable to like all of a sudden policy changes. So, the whole tariff situation, large companies can absorb changes like this, small businesses can't. And, that change is felt immediately. So I was thinking about what I would want to ask lawmakers. And really, it's for small business manufacturing locally, we need policies that support any big transitions like this. So that could include tariff relief, or a phased implementation for small businesses, easily accessible grants or tax credits to offset the cost of domestic production. Um, so when I say phased implementation for small business, I mean honoring existing orders, providing advance notice or gradually increasing rates. It just seems, we had this figure and then all of a sudden, just because of it, one day, one date, we ended up paying so much more. So that's what I would hope policymakers would pay attention to. I'm a Mainer. I would like our hope eventually down the road was to produce in Maine. So we've had to really pivot and figure out ways to do this. We've been doing this for 2 years without any paychecks for either one of us. It's really been a labor of love. And, you know, as a policymaker, I would just hope as, especially if you want people to manufacture and produce in the United States, there has to be a system set up. Not only is there not a lot of manufacturing happening, there has to be ways for systems in place to, you know, yeah, we know it's going to be more expensive. So here's what we're going to do to help you in that way. So I guess that would be my ask.
Thank you, Becky.
You're
Uh,
welcome.
and I mean, the business itself was a labor of love in the first place. And really, I hear how much you care about the people you're trying to serve with
Mhm.
this product. And I can't imagine how frustrating it is to face those kinds of choices. And especially you saying, like, I cannot raise the price to this extent on people who have, been dealing with cancer.
Right.
So it's
Yeah,
a,
it's a really fine line because, I mean, ideally, we would I mean, it makes me so happy to say, like, oh, yes, we are producing these clothes. I mean, we have a woman sewing them in Rockland. I love that. But it's a lot more. And I don't know how, and even the fabric, buying anything, our production company in India, our cost per garment included everything, the tags, the fabric, all the thread, the care labels, it was everything. The hang tags, our labels. Now we're having to source all of that out. And it's honestly much cheaper to buy fabric overseas, but not with the tariffs now. So we are trying to really, I mean, it's been a huge learning curve.
Great. Well, I would love, honestly, to spend even a lot more time on your story, but we are on a limited time
Yeah.
crunch here. But thank you again for sharing. And I want to take this moment to say, I would really encourage folks. I know not everybody is going to sit down and read like a 40-page report that's very dense all the way through. But I would really, really encourage people, um, if all you're going to do is skim and look at the charts, read the stories that we include from people because they're really powerful. And I think they do a wonderful job of illustrating some of the numbers that we're talking about in an on the ground way and showing what, real people in Maine are dealing with, not just, talking about the data and the numbers. So thank you very much again for joining us, Becky. And yeah, I would encourage anyone to go and read Becky's story in full in the report because it's really powerful stuff to read.
Yeah, thanks for this opportunity to share it. I appreciate it.
Thank you, Becky. So we transition into talking a little bit about the safety net. James, if you want to get started.
Yeah, so I mean, I've already mentioned kind of like the idea of policy choices kind of shaping the economies of different parts of Maine. And we talked about the COVID recovery, but I think also thinking about just the way in which state and federal spending in general is helpful, both for like the individuals involved. I think a strong safety net precisely because of like the higher rates of poverty that we've seen, the precariousness of work in some of these parts of Maine, like the decisions that are made in Washington and in Augusta about how the social safety net functions can be really important and especially important for these more rural parts of Maine. We do go into the report for folks who want to dive a little deeper on some of the history and kind of how changes, especially in the LePage administration, kind of hurt folks in the more rural parts of the state by taking away eligibility for SNAP, by not expanding Medicaid. But in terms of kind of what the situation looks like today, I mean, SNAP, I think, is a really good example of a safety net program that also is an economic program. And we know that so SNAP is the Supplemental Nutrition Assistance Program, the old food stamp program. We know that for every dollar that's spent on that's provided to folks for food assistance generates about $1.50, a little over that in the local economy. And there can be a temptation, I think, to think of safety net programs as being helpful to certain kinds of Mainers or certain areas of Maine. I think there's often rhetoric that it's like just something that flows to Portland, but actually in terms of like the share of the economy that it supports, SNAP dollars actually support much more of the economy in the northeastern and western parts of Maine, where they are often going to independently owned grocery stores and then being spent on Main Street by the cashiers and people that work there. And we also look at Maine Care as well, which I think we have on the next slide. And this chart shows the share of the population in each part of the state that is enrolled in Maine Care. We know that the most high profile expansion of Maine Care is kind of the Affordable Care Act's Maine Care expansion that occurred in it was approved by voters in 2017, but did not actually come into effect in Maine until 2019 because Governor LePage had blocked it, and Governor Mills signed it into law on, I think, her first day in office. So that expanded the number of folks who are eligible for Maine Care in the most high-profile way. But there have also been a number of expansions that the legislature has undertaken since. Access to the Maine Care Savings Program for older Mainers, also access to the Children's Health Insurance Program, which is part of Maine Care. And these two bars show the share of the population that is enrolled in Maine Care in different parts of the state between 2018 and 2025. And what you can see is Maine Care enrollment has increased across the state, but it's especially high in the northeastern and the western parts of the state. So again, Maine Care is providing kind of a crucial health insurance safety net for folks in those areas, but it's also helping hospitals because fewer people are coming in without insurance who still need to be treated. And the hospitals are some of the largest employers in those parts of the state. So those are both kind of examples in which those safety net programs are helpful for people, but also helpful for the economy in those areas.
Thank you, James. And I'd actually like to transition to our other storyteller who has joined us today, Jesse. Jesse is a carpenter living in Hope with his wife and daughter. They are expecting their second child in 2026. Congratulations, Jesse. And in State of Working Maine, he shared a very powerful story about working in rural Maine, raising a family, managing a home, and navigating the realities of healthcare that does not always feel affordable or reliable. So Jesse, I'd like you to talk a bit about how you've managed affordability challenges like healthcare and benefits, balanced work with personal life, and of course, what your message would be to Maine lawmakers so they can help support that work-life balance.
Yeah, thank you. I'm a carpenter. I'm on my lunch break right now. We're halfway through renovating a kitchen here in Rockport. So I live in Hope. I drive 15 or 20 minutes over to the coast and pretty much spend my days building up and improving some really beautiful homes. We have a great little house too, and we are expecting, like you said, our second child any day now. It's wonderful. So I could get the call right now and have to leave. But yeah, we moved up here about 10 years ago, first to South Portland, and then we got a house in Biddeford. Thank goodness we were able to afford a house when we did, because as everyone knows, the real estate is crazy. So I feel very fortunate because I can't imagine paying rent that would cost more than my mortgage. But with owning a house, there are so many things: keeping oil in the tank, keeping your vehicles running so you can get to work, splitting wood off the land. It was a very romantic idea moving up here to Maine. And as much as we still love it, it's beautiful. It doesn't feel as affordable as we were expecting. The mid coast is pretty expensive. My partner and I both grew up down on Cape Cod. I feel right at home here on the coast of Maine, very touristy, the sailboats in the harbor. So it's picturesque, but it's also really tricky to manage groceries and childcare. I mean, we ended up spending all of our tax returns on daycare so my wife could work. However, she wasn't making it didn't make sense. You know, you actually do the equation, and the childcare was more expensive than the money she was earning. So we stopped doing that. She's been home now, which again, I'm grateful. We're blessed that she can do that. But the harder I work and climb the literal ladder here as a carpenter, the farther away we get away from a safety net. The more I earn, the less likely we are to get any aid. And for example, I actually turned down the healthcare that my company offered because I needed that money in my paycheck every week. So as I'm using power tools and I'm climbing up on scaffolding and I'm inhaling chemicals here. I'm just hoping that I don't get injured. So if anything happens, I mean, we're probably kind of screwed, which is not a great feeling. I mean, you want stability when you're raising a family. And so, yeah, I basically just buckled in and I'm a dad now and I'm working my butt off. My story is not unique. Most of the people I work with are in the same boat where they're scraping by, they're doing side work on the weekends. They have kids to support and we're all working hard to support this kind of like tourism vacation land getaway. A lot of the houses we're working on are folks' third or fourth home. They're empty most of the year. And so that kind of just adds a little insult to injury when I'm like, do you really need a new kitchen? You know, there's people who need a lot more help. Again, no shade for people who have found that success in their life, but it's definitely tricky to be part of the labor force and feel so disconnected from um, stability and that kind of thing. I don't know. I don't know what to say about policymakers or anything like that because I don't know what to do. I mean, luckily my partner and my child are on main care because we probably couldn't afford to deliver a baby if not. So they're covered, and that's the one thing that makes me feel secure and happy is that no matter what happens to me, at least the fam is doing okay. And thank goodness for main care. We do not qualify for SNAP. I don't personally qualify for main care. So yeah, I'm just kind of out there doing my thing, being extra careful with the power tools. And even if the health safety net were greater and more accessible to more people, would Maine even have the doctors and the staff to support people getting appointments? I've had to wait almost a year to get a primary care appointment. Um, the Belfast midwives were absorbed down here to Penn Bay, so like that's a unit, a healthcare unit that has shrunken. And so to me, it's like it would be great if more people had healthcare, but I don't even see that working. Again, I haven't done nearly as much research as you folks, but my story's, this is my lived experience here. I love it, but it definitely poses some challenges, and it's a lot less affordable, especially in the mid coast, than we were expecting. Um, so that's where I'm coming from.
Thank you, Jesse. And yeah, I definitely hear you on that last part. In a previous State of Working Maine, we had spoken to some healthcare workers who were considering leaving the field in some cases because of experiences they were having, particularly with pay. But I think your story does such a good job illustrating the really difficult or impossible choices that a lot of families in Maine have to make right now. I personally have friends who have done that exact same math where they're looking, they want to work and then they look at how much they'd be making versus how much childcare costs, and it just doesn't make any sense for them to do that.
Yeah.
Um, and there was a quote from you in the report that I particularly liked that was, um, if I chop my finger off on the table saw, the deductibles and coinsurance are so high. How do I pay for that? Honestly, I'd rather have that $4,000 to put towards my credit card because that's how I'm going to be paying for the healthcare anyway. And I think that does, again, a really good job illustrating. I mean, like you said, if something happens, we're screwed. That's how a lot of people feel in many, many different categories right now.
Yeah, it's true. I mean, the specific healthcare I was offered, I worked for a different construction company and they paid for your healthcare. That was amazing. This company's a lot smaller. They can't do that. So, yeah, the amount that I'd be paying week just to be a part of the club and then the deductible and then the co-insurance, I was like, man, yeah, I would rather have that $4,000 or $5,000 it would cost to just maybe not even use the healthcare. I mean, we all know how that works. And so I've always had healthcare up until these last few years, and it feels very risky. I don't like it, especially using my hands and requiring my hands and body to make money at all. In my line of work, I should absolutely be protected. And so people will probably think I'm silly for not just ponying up and paying for it. But like I said, that $100 a week that would be going toward my healthcare, I actually would rather utilize that in my day to day for groceries and take the risk. I don't like it. I don't like it.
Yeah, no, I cannot imagine. And I think we're seeing with both your and Becky's stories the way that unpredictability really makes a lot of these issues worse, whether you're looking at your own home life and family life and health, or you're trying to start a small business in Maine. The unpredictability is just really making a lot of things worse for people. So, thank you again for sharing your story. And congratulations again on the birth of your next child. If you need to leave now and go check that out,
I appreciate
please
you
do.
all so much. Yeah, this is really cool. I'm happy to be a part of it. I hope we can make some kind of change from the bottom up here. Um, Good luck to you all.
Thank you. Well, thank you very much, Jesse. So I believe now we're actually going to transition more so into policy choices. So with the right policy choices, rural Maine can build on its strength, expand opportunity, and ensure that prosperity goes across the whole entire state, not just parts of it. So I think we all know on this webinar, Maine's economic future is not going to be secured through corporate tax breaks, right? It's not going to be secured through incentives that concentrate benefits in already prosperous regions. The evidence is really clear: investing in people, strengthening labor standards, ensuring that work pays in every corner of the state. Those are the most effective ways to support rural prosperity. So I'm going to kick it back to James to talk about some more specific policy recommendations that we make in the report.
Yeah, thanks, Kara. And I'm glad Jesse kind of finished on that note of like change we can make as well. I mean, we talk about in the report a number of different things, touching on sort of different elements that we've got out of the report. I mean, we talk in the report about the impact that the minimum wage has on reducing working families' poverty, and so protecting and strengthening the minimum wage, including phasing out some of the exemptions to that, like for tipped workers, is important. There are pay transparency and pay equity laws that are working their way through the legislature. Some of them are just waiting for funding, and strong enforcement of those would help to close some of these gaps that we see for men's and women's wages, or the wages between white Mainers and people of color. As we've sort of heard about already, expanding access to childcare and care for older adults and adults with disabilities is really important, both for increasing access, increasing labor force participation, allowing more folks to go out to work, and of course, just ensuring sort of the right kind of care for those vulnerable people in our society. Um, One of the things we didn't show in our charts, but we talk about is kind of the importance that the public sector itself has in setting wages, especially in these more rural parts of Maine. There are actually more public sector workers, especially educators, make up a larger share of the workforce in these more rural parts of Maine. So the direct wages that the state sets for its own workers, and then kind of indirectly for people like teachers, really make an impact in these rural parts of the state. And then a bunch of different kind of safety net program reforms, kind of modernizing the unemployment insurance system, which a lot of seasonal workers rely on, having things like subsidies for the health insurance or access to main care, which helps in these areas of the state where health insurance is actually especially unaffordable, and there are actually legalized forms of geographic discrimination in the health insurance marketplace in Maine. So insurers can and do charge people more for health insurance just because they live in Aroostook County versus in Portland, which is a little crazy when you think about it. And we want to, I know in the comments, folks have talked about the big, beautiful bill that was passed. And since we know that a large number of folks rely on some of those programs, especially SNAP and Medicaid, in these more rural parts of the state, it's especially important for lawmakers to kind of defend these programs. And a lot of the talk is on punishing people who can't find regular, consistent work by taking away their safety net. And that's both like crazy on its face because it sends people into the spiral of having no work and no safety net. But it's especially damaging for those parts of Maine where work is harder to come by.
Thank you, James. So I think we might want to start jumping into some of the questions that we've received. And if anybody else has questions, now would be a good time to throw them in the chat. So to start, and this is definitely a question I appreciate. Having had a lot of friends back where I grew up who did not have vehicles, which is what about public transit from Lisa? She said, you didn't talk about this in your report, but it's really hard to work if you can't get to work. It's hard to eat if you can't get to stores or to food pantries. As the cost of both new and used vehicles rise, transportation-related discrepancies between urban areas with public transit systems and rural and small town areas without them is bound to increase. So what are your thoughts on that, James?
Yeah, I think it's a really good point. And it's one of those where I'm like, man, we should have included that more in the report. But yeah, I think it's a good point. I think not just kind of access to public transport, which I think even in the more urban parts of Maine is like kind of spotty. And public, like the majority of Mainers across the state still use like their own vehicles to get to work. But I think even when you think about that, like the fact that folks in more rural parts of the state are not only more reliant on cars by necessity, but like have to drive further to be able to get to work or even just get to the grocery store. Like those are hidden extra costs that don't always show up. So even when, you not only got lower wages and wages that are maybe more intermittent, but you've got these extra costs that people are struggling with as well that a lot of folks do overlook. So I'm glad you raised that.
Yes, definitely. That's a very good point to make. Um, so the next question is from Anne. The Trump BBB is going to make healthcare and SNAP access so much harder. Do we know what the impact of those cuts will be?
Yeah, we have been doing some work at MECEP, and there are a few articles on our blog talking about the impact of those cuts. Some of them are better known than others, but we know that tens of thousands of people are at risk of losing their Medicaid coverage and their SNAP access to their SNAP benefits. Um, as I said, most of those are. Well, there are some categories of people that are just now cut out of the program altogether, especially some folks based on their immigration status, folks who are here with like legal immigration status coming as refugees and folks seeking asylum. Some of those, we actually just had a hearing in the legislature yesterday about having some of those covered by state dollars. Um, but the majority of folks who are impacted are a lot of people who the work requirements that are already in the SNAP program and are being rolled out to the Medicaid program are being expanded. And again, kind of to that point I made kind of at the end, like this is like unnecessarily punitive effects. It's affecting more people with kids who have childcare issues, and suddenly they're going to be told if they don't get out to work, um, they are having they're going to be punished and have their safety net taken away, which is going to make life harder for them. And what we don't have right now, but I'm hoping to work on, is kind of like what this looks like in this discrepancy between the rural and more urban parts of the state, because as we know, like these are areas where if work is harder to come by in these areas, these are the areas where they're going to be more harshly impacted. And it used to be the case that the SNAP program has waivers in it where the state can apply for a waiver of the work requirement in areas with high unemployment. The report details a little bit the ways in which when Paul LePage decided not to have that, it had really hurt people in rural Maine more. And we're likely to see the same thing now because the federal bill restricts your ability to do that. So it's even acknowledging that like we don't want people in areas with high unemployment to get an exception for this. So.
Thank you, James. And I did just want to quickly shout out because I see Colleen in the chat, who's from a fantastic organization called Full Plates, Full Potential. And if you are interested and passionate about food security and SNAP and ensuring that especially children have enough to eat in Maine, I would definitely recommend checking out Full Plates, Full Potential. They're a really great organization. So if our webmaster could throw a link to their website in the chat also, that would be great. So I think we might have, do we have time for one more question, James? You
Fine
think?
by me.
Okay. All right. So I just want to jump to Shannon's question. I'm curious how you think the story about poverty trends over this period might differ if we were using a measure like United Way's ALICE standards instead of the federal poverty line.
Yeah, that's a good question for folks who don't know. So the federal poverty level is definitely limited in kind of what it measures because it's only looking at this sounds bizarre, but it is based on a food budget from the 1960s, I think, basically, and just multiplied by three and adjusted for inflation. So it's a very crude measure of what poverty looks like. Um, and I mean, so there are a couple of other different measures. One is like the supplemental poverty measure, which includes kind of the different costs of things and different benefits that people are receiving. And then the ALICE measure is something that the United Way uses. It stands for Acid Limited, Income Constrained, and Employed. So largely folks who have income above the poverty level, but not enough to meet basic expenses in the county where they live. So it's similar to it's similar to kind of the living wage, but metric that we use in one of those charts there. Um, it would indeed be interesting to look at that. If I remember correctly, some of these Alice measures have declined also over time, but maybe not to the same extent. And it is true that we sometimes end up with things like the minimum wage helping to lift families out of absolute kind of poverty, but still not necessarily being able to make ends meet, especially when you've got costs like things like childcare and housing like rising much faster than wages. So
Great. Thank you, James. I think that we will actually wrap on time for one of the first times with one of these webinars. Thank you so much to everyone for joining us today and to our storytellers as well. Um, Following the webinar, we will send out an email later on that will have both the webinar recording, but we will also include any links we've shared throughout the webinar. We'll put a link to Becky's company here as well, and any other links that would be helpful for our storytellers to share out. If you have any questions we didn't get to or anything else you want to discuss, you can always reach out to us at info@mecep.org. And our contact info will also be in that big email that goes out later on. So thank you so much to everybody for joining us. Thank you to our storytellers and to James. And I hope everybody has a really good rest of their day.